Good evening. I am Dr. Sunil Dharmani. I'm a nephrologist working in NHMMI Hospital in Raipur, and I have done my DM nephrology in 2009 from KEM Hospital, Mumbai. After that, I am practicing in Narayana Hridayalaya Hospital, now called as Narayana Health, and I have a post DM 12 years experience in nephrology. Today, my talk is on infection in dialysis patients. What are the causes and how to prevent? So, infection in dialysis patient is very common, and this infection is, as we see commonly, through respiratory route, as well as there are many ways in dialysis through water facilities, through equipments, and through blood contacts. So these dialysis patients, they are more prone for infection because of low immunity. And secondly, because of the equipments being used and the contact of blood, the hemodialysis patients are at relatively more risk. And third point is because of the use of these access catheters, tunnel catheters, as well as the non-tunnel catheters or needle use, blood transfusions, and changing of dressing during the cleaning of catheters. So these are the ways where infection can be transmitted. So what are the infections which we commonly encounter? The most commonly you see because of these is hepatitis. Main is hepatitis C, hepatitis B, and even HIV. Other infections are bloodstream infections, which can pass through catheters or needles. And add on usual infections because this dialysis is under a closed unit. So somebody having a respiratory infection, which is a normal route of infection, they can also pass the respiratory infection. So now the point comes, these are the ways out how to prevent it. And before that, what are the signs and symptoms of infection? So usually if there is a bloodstream infection like a catheter, secondary to catheter induced infection, then the patient will present with fever, chills, and rigors, and sometimes patient may present with a hypotension, low blood pressure. And then you detect it by the blood investigations and the blood culture, and you have to give antibiotics. Other infections, if it is through a respiratory route, they will commonly present with a cough and fever. And third comes a chronic infection, which we see is hepatitis, which we catch usually through investigations. Like there's a deranged LFT in the case of chronic hepatitis B and C. Sometimes we can get fever, and then we have to do the markers like HBV DNA, HCV RNA, they turn out to be positive. So these are the infections and their presentation. So how to prevent it? The prevention, the first and foremost is, because the infections are also transmitted through healthcare workers, so the hand hygiene is the most important for the workers as well as for the patients. Second comes cleaning of equipments. Cleaning of equipment means surface cleaning of dialysis machines. Third comes wearing mask, avoiding cough and sneezing. So mask should be there, so it will prevent. Fourth comes because it is transmitted through the blood. So when you are cleaning dialyzers, so proper cleaning of dialyzers, because in some units there is a reuse of dialyzers. So we have to be cautious. We have to clean properly with proper solutions, which is recommended, and proper time duration, which is required, that should be for cleaning. And then comes the needles which we use. The healthcare worker has to be clear in that they should wear gloves, and if they are not wearing it, ideally they should wear gloves. Then in between, sanitization of hands, proper sanitization, there is a proper guideline that should be done. So in this way we can prevent the bloodstream infection. The second is the catheter. Proper cleaning of the dialysis catheters with the help of solutions, like we use chlorhexidine solution for the hand cleaning. There is antiseptic solutions for the cleaning of dialyzers. There's antiseptic solutions for cleaning of the catheter hubs. The catheter hub, when you open the catheter, then you have to clean the hub properly, and with proper care we have to connect that tubings to the catheter. Once it has been disconnected, it should be again cleaned and then closed. So proper care of the catheter. Second comes the exit side of the catheter. Sometimes you see a pus collection there. So where the suture has been done, that has to be cleaned properly. And what we use is usually appropriate antiseptic, which is recommended. And along with that, what we use in the case of fistula, when we use needles, is same antiseptic we use properly prior to that, even after that. So the proper care is needed, and the healthcare worker, that he has to take care properly. We teach our staff, our technicians, and even doctors who are in the dialysis units, whenever they touch patients, then they have to sanitize their hands. And in this COVID era, the proper care, because it is a contagious disease, and because of that has become more important. So we are following, and we recommend to everyone to follow the strict guidelines. The guidelines has been already been given everywhere. So these are the basics of these guidelines: cleaning of hands, maintaining proper hygiene, wearing gloves, and with the proper antiseptics, we should clean the prior to the needle, the areas, and as well as the exit side and the catheter hubs. Now, blood transfusion has to be properly done during dialysis, because sometimes this can also cause reactions. And second comes, because they are the also source of infection, and add-on is the proper care with the, we have to see that all the patients are vaccinated. Those who are joining in the dialysis unit, they should be vaccinated with hepatitis B vaccine, so that this is a preventive aspect, so that can help. And for HCV, because these hepatitis infections are also transmitted through surface, so we have to clean them properly. So this is a proper method how we should go for prevention of infection in dialysis patients. Thank you.